Hi, hello. This is chapter 6. In this chapter, we talk about some of the term in the skeletal system. Skeletal system means the bones. So the first one, osteitis. I'm not sure my pronunciation, but oste normally means the bone, and itis inflammation. In Biden word, it means bone inflammation, but actually it's not. So that's one thing when I was preparing this class, I want to say, and at the very first introduction, I mentioned that some of those medical terms are about, like you're playing Lego combination. However, it only can give you a clue. The real meaning of the word, you still have to look for it. For example, this one, osteitis, seems like this bone inflammation, but it's not inflammation in anywhere. In more specifically, it's bone. It means inflammation in the jawbone. We have two jawbones. Oh, let me see how. Try to snap. No, it's not. Anyway, they call it the upper jaw and the lower jaw. Upper jaw, maxillary, and lower jaw is mandible. Mandible. All right. So these are two jawbones. And then what's the feature about jawbone? You have teeth grown here. The teeth grown here. And then in some cases, and you have to extract the teeth. And let me see. Here's how the teeth grow. The teeth grow in the bone, and this call it the socket. And above the socket, you also have the soft tissue to hold the teeth here. And when you extract the teeth out, the bone itself is exposed to the air, and then all the bones. That's right. I mentioned this. All the bones are covered by a membrane, osteomembrane here. So if there's no membrane covering the bone will feel very painful. And after you extract the piece, normally, say, the blood from the blood clot will form here, which serve partially as the membrane to protect the bone. However, for some reason, if the blood clotting will fall off before the bone memory grown here, then we have a condition called osteitis. In other words, they can also call it dry socket symptoms. I myself had this when I extract my wisdom teeth, and that's why when you extract the teeth, mostly you are not recommended to use a straw to drink water, because this is low oral pressure will causing the blood clotting. So this is the osteitis. And then osteoporosis. Oresis means something like that. Or osteo means the bone, and por means just porous or pore. And then the status. What does it mean? Let's draw another bone here. So in the center, this is the bone marrow here. Medullary bone marrow is big connected marrow, and then on the head. On the head of it, they are this is also called a bone marrow, but largely very small bone marrow. They're connected to each other. So this kind of call it the part, The empty cavity, small empty cavity called porus. In many cases, the porus is actually red, because those we call it the red bone marrow. The blood cells are produced there, and then the walls that holding the porus together, they also have a special name. They're called NC. Trabeculae, which is a plural form. Trabeculae, I think, is a plural form or single form. I don't know. Trabeculae. So, yeah, let's say, let's compare this one. In one cases, you have smaller okay. And then in these cases, you have a smaller porus and a thicker trabeculae. And in these cases, have a bigger porus and a thinner trabeculae. So in these cases, you can tell that this is stronger and this is weaker. And in many cases, this is at this condition we call it osteoporosis, which means the trabeculae in the bone become thinner and thinner. When the trabeculae become thinner, the bone itself becomes more fragile and more increase the risk of having a bone fracture. And what's the cause of this? In many cases, it's caused by the calcium, the calcium deficiency, or in some cases also maybe related to the lack of the physical exercise. And these two things at the beginning, the people do not really feel much. So it also called it the silent killer of the bone, something like that. So you don't feel anything until the people get a bone fracture. And and how to prevent it? Taking more calcium and more exercise. And let's keep moving. Here, this next one. Still the malacia. Malacia means soft. Osteobone. That means softened bones. See, even in word, it's considered as not really word. It's not used often, to be honest. And osteocarcinoma. Carcinoma is related to cancer. Osteobone is a bone cancer. And let me see. It's it's not every bone cancer. Bone cancer itself has many forms, but osteocarcinoma is a rare bone cancer that normally happens in children. That's we don't have to learn more about that. Let's say next, osteochondritis, inflammation, osteobone, chondra, cartilage. So, and this by the word it means bone and cartilage inflammation, but in most cases this means the cartilage inflammation, and more specifically, you see you have did I mention this? So you have two bones and things. I think I mentioned this last. In the two bones, when they join together, this is they call it joint. And then between joint, on the surface of these two bones. The two bones never contact with each other directly. They're always a cartilage in the cartilage to cover the bones in the inner surface of the bone. And this call it articular cartilage. Articular cartilage. And osteochondritis means the articular cartilage has been damaged, and then because of it being damaged, inflammation happens. We use a titus to explain inflammation, but how the inflammation happens is caused by many different things. Okay, so let's continue with the arthritis. This is very often used for arthritis. Arthritis. That means inflammation of the joints. Joint inflammation. And what's the and arthritis has many different type of arthritis. The most common call it osteoarthritis. What is osteoarthritis? Take a look here. The articular cartilage. Articular cartilage is a cartilage tissue, and it's alike. There's a just indicating here inside the cartilage there are special cells. Those cells call it chondrocytes, and the chondrocytes are keeping the homeostasis of the cartilage, the articular cartilage. However, for some reason, and we do not know for sure, probably overuse or other things, the chondrocytes are dying. When the chondrocytes are dying away, the cartilage, the articular cartilage is getting off. When they're getting off, and then let me use the bone tissue growing on the surface. And again, if the bone attaching, the bone tissue itself attaching itself, it's very painful. And this is the most common type of the arthritis, osteoarthritis. That's because the degeneration of the chondrocytes. There's another type of there's another type of the arthritis called rheumatoid arthritis. You may have heard of it. What is rheumatoid arthritis? The membrane of this enclosure of the joints is closed by this membrane, and this membrane is made up by cells called synovial. And like a synovial, this media is this cavity is filled with a fluid called synovial fluid. And what is synovial fluid? Syno means light. Vial means like egg white. So this is a colorless fluid. It's just like egg white. That's why it has this synovial fluid. And then the synovial fluid is produced by the synovial cytes, which is in the inner layer of the membrane, or in the enclosure, whatever. So these synovial cytes have two major types: macrophage-like synovial cytes, or fibroblast-like synovial cytes. Macrophage-like synovial cytes is to clean up the debris of the cartilage, garbage. And generally, the macrophage-like synovial cytes does not have or will not turn bad. However, the fibroblast-like synovial cytes In some cases, they will turn bad. But it can turn into a cancer-like cells. And so also the fibroblasts, like synoviocytes, has many different functions. They produce the synovial fluid. Also, they produce many factors to serve as immune cells. So in these cases, when they become the cancer-like cells, they will migrate into the cartilage. And so, and they will damage cartilage. And then when there's no cartilage, again, the bone becomes exposed. So osteoarthritis and the rheumatoid arthritis, both features, but have different origins, different causes of the origin, but both features the degeneration of the cartilage to the surface of the joints. Okay, let's keep going. Next one. And ankylosis. Ankylosis, that is also a joint issue, is similar to the arthritis. There's also stiffening and lack of the motility of the joints, but this is caused by the fusion of the joints. And why fusion? Why it can have the fusion of the joints? In many cases, that's because the again the cartilage tissue. The cartilage tissue can become a bone tissue, and the cartilage may just fuse to each other. So ankylosis fusion, that's a fusion of the joints. Something happens more often is I'm trying to draw. This is the sternum. This is the chest bone. The chest bone connect to the rib bones, and these bones are joined together by cartilage, and this cartilage may convert into bones, and then this ankylosis happens. When this happens, they will be reduced. The chest becomes less flexible, and overall the breathing capacity. Okay, next one. Maxillitis. Maxillitis, as we mentioned, maxilla bone. That's the sorry. So this is a skull. If you have a skull, the upper jaw, the upper jaw bone is the maxillaris, and inside the maxillaris there are also sinus, and this is the nose, and the nasal cavity also connect to multiple cavities inside the bone. These are the nasal sinus. And then when you have some kind of inflammation in your nasal cavity, sometimes the inflammation migrates into the sinus, and it's like sinusitis. Not sure, sinusitis. So, and this the sinus develop the inflammation, and the maxillitis is one of the sinusitis. That means that the maxillar sinus develop the inflammation. Let's keep moving. Bursitis. That means a stone grow in a bursa. What is a bursa? Bursa is it's basically a sac. It's largely like a joint, a synovial joint. However, it has only the fluid and enclosure membrane without bones and cartilage inside. It mainly serves as a cushion surrounding the joints. You can say this one joint here, and this is the joint itself, but you may have cushions outside. So the joint itself is filled with the synovial fluid and also the bursa. the bursa also filled with fluid. It serves as a cushion. So Persolite means a stone growing in there, and largely because the stones, whenever we talk of stones, in many cases it's caused by the calcium deposition. And bursitis, that's the inflammation of the bursa, maybe injury and the inflammation in the of the pelvis. Very little. Meniscitis. Before we talk about this meniscitis means the inflammation in the meniscus. What is a meniscus? You may heard it. That has been the cartilage in the knee joints. And the meniscus itself has different meanings. For example, here we have a cup, and you pour some water in the cup. Okay. Does the water stay like this? Very unlikely. The edge of water will climb up to the cup. This is called meniscus. Why? Because water molecules can form a hydrogen bond with the wall of the cup. That's why it's lining up. And why we call this cartilage a meniscus. Let's try to draw. This is the femoral bone, and this is lower. This is the tibia bone. And see, both femurs and tibia have two paths. In this case, you need a cartilage. So, and this cartilage is shaped like this. There are two meniscus. See, it's very similar shape. The edge is up and the center is down. So that's why this two cartilage are called meniscus. And the knee meniscus is probably, I'm not for sure, but I believe this is the most evolved. It's pretty strong. Actually, the meniscus cartilage is the only bone that can have some level of regenerative itself. It's still, I think, it's one of the strongest, the strongest cartilage. However, it's also what the cartilage that have to endure the strongest strength of the body. So it's very easy to get damage of this meniscus. When it gets damaged, it develops inflammation. Yes, titus. And there's another thing, as I mentioned. This is the only meniscus, the only cartilage have some level of regeneration because in the edge of the meniscus, I don't remember which side, I think in this, some level of not every part, some on the edge of the meniscus, you have some level of blood inflammation, of blood supply, and that's why you can develop meniscitis. For example, if you just damage your ear cartilage, it's very unlikely that the ear cartilage can develop any type of inflammation because there's no blood. There's no blood supply, no inflammation. And the reason that meniscus can develop the inflammation, meniscitis, because the blood is there. So if you damage the meniscus, there may be inflammation due to the presence of the blood vessels. That's the whole thing here. So this situs means the inflammation of the disc or intervertebral disc. What is the disc? This is the vertebrae. The bones. vertebrate bones. And then this vertebrate bone itself is a bone, right? They do not move. And why we can bend? Because within each of the two vertebrae are intervertebral disc. And let's see, this intervertebral disc is, did I mention this? The problem happened here is one of the number one cause of the disability, because here there's something else going on. This is the spinal cord. Yeah, I think I mentioned in the last one. Anything happen if the intervertebral disc become larger, it will pressure to the nerves from the spinal cord. And here, in discositis means inflammation of the disc. Normally the disc does not really have those inflammations. Here is a very severe inflammation because that means that the bacteria from elsewhere already migrated to the disc. So let's keep going. Having space. Yeah. Arthrodiosis. What's arthrodiosis? It's similar to ankylosis. Ankylosis is the fusion of the bones of a joint. Arthrodiosis is also the fusion of the bones between joints. However, what's the difference is that ankylosis is the spontaneous procedure. It's a pathogenic procedure that the two bones join together in a joint. However, arthrodiosis is a treatment. It's a medical treatment to artificially join two bones together. Why they want to do so? Some cases that's because the arthritis. So here, the arthritis may become too serious. There's a last treatment for arthritis is that, okay, let's remove the joints at all and fuse two bones together. So this joint can no longer function, no longer move anymore. However, the benefit is you don't have the pain anymore. So for the last treatment of arthritis, just remove the joints, fuse two bones together. And this treatment is called arthrodiosis. Yeah. Arthroplasty. And there's another treatment. So a bone, a joint, especially for arthritis, is beyond repair. You go to arthrodiosis. But in some cases, especially the knee bone, the knee joints, when the cartilage here is beyond repair, you remove the meniscus out and replace by an artificial joint. In this surgery, call it arthroplasty. So let's move on to the bursaotomy. Means open up the bursa. Say take out the bursa stone or bursa, whatever. And treat and like say, yeah, this kind of craniotomy. Open up the scalp and craniotomy. open up the scalp. And why you need to open up the scalp? To have access to the brain. And why you need to have access to the brain? There are many reasons. For example, brain tumor, you need to take that brain tumor. Or you can do any of the surgery in the brain, you have to open out the scalp first. And it's very difficult, to be honest. If you see the things, is feel like if you see the tools to open a scalp, it's like you're seeing a carpenter tools. And it's not really interesting. During the pandemic, COVID pandemic, many of those the craniotomy surgery is stopped because the flesh that's flow everywhere. You cannot stop it, and increase the chance of get infection from the COVID-19 patients. So during that time, COVID-19 patients cannot do the craniotomy. Anyway, let's keep on moving. This next one, carpectomy, take away. And what is carpal bones? Carpal bone means the wrist bones. Carpectomy means take away the wrist bones. And why you take it away? Inflammation or abnormal shapes, etc., etc. Just for some reasons. And the same thing, tarsectomy, ectomy, take it away. What is the tarsal bones? The ankle bones. So why you need to take ankle bones? In many cases, with our bone here, as a ankle bone forming the arch of the feet. Sometimes the arc for some people there's arc is too flat, they cannot walk for a long time. But some cases the arc is too high. When it's too high, one of the treatment for the too high the foot arc is to take away some of the tarsal bones. Let's keep moving. Next, the next is lectomy. Take away partial or the whole maxilla bone. Why do this? In most cases, there's a tumor growth to treat tumors. And many of those ectomies is to take away the tumors. Meniscus, take away the meniscus. Why do you take away the meniscus? Meniscus is damaged, and then you replace by the artificial joints. Bursectomy, take away the bursa. Sometimes it's because it's too inflamed, and theoretically it's okay if you lose one or two bursa, and if they continue to have the inflammation in the bursa, you take it away. Page. What next? Costectomy. Again, take away. What is costal bone? Yeah, costal bone means rib bone. I think costal, because I think I learned from my previous students, costal in Spanish or Latin words means the rib. So costomy means take away the rib bones. And this is, in many cases, it's not for treatment or cosmetic. Yeah, cosmetic, right? Yes, cosmetic surgery. Take the whole rib or part of the rib to make the wrist seem thinner. It's not healthy. I don't think so, at least. Okay, next one. Osteoclastis. Osteo, the bone. Classes means bone break. Classes means break. It means a surgery. It is a surgery to break the bone in purpose. Why need to break a bone in purpose? And for many reasons. For example, in some cases, some guy has a bone fracture, but at that time he or she did not have the opportunity to go to the hospital, and the bone heal in the wrong places. In these cases, you have to break the already healed bone away and let it heal again in the right position. Yeah, and in some cases, There are other cases that some people have the mild development in the early childhood, what can dwarfism, dwarfism, right? Yeah, and the bone has a say like this the leg and the legs and the arms in a say curved shape. You can break it and then reshape in a good position. And this is for the good reason. For some reason not that good is that again this is the leg, the femoral bone, tibius, and the fibius. Some people may just break the tibia and fibius and stretch when the heel become longer. It's not people doing this. Let me see, is it bend? I'm not sure it's bend or not, but it's not 100% safe. People can get taller, but not, I think it's banned in the US, but not super safe. That's why it's banned in the US. Even though you can do this, I think in the Caribbean, some of the Caribbean hospitals, they can do this. Yeah, but there's a adverse effect of this. What's the next one? What's um, osteo last osteoplasty. There will be a collective form to any of those bone reshaping surgeries. I'm not sure what kind of things. Some people may like say making the lower the mandible lower jawbone like sharper is one of the things I can think of. And what else? Yeah, I don't know. Okay, the last three. They are I would like to have a new page of it. Cells, osteocytes, osteo of osteoblasts and osteoblasts. You learn more when you go to the real anatomy physiology, learn all of those cells. Osteocytes is the most abundant cells in the bones. So bones, in human bones, they are in layers, by layers, by layers, by layers. And then osteocytes are those are the cells between layers of the bones. They stay between layers of and this is of the bone matrix. And then in the center, this is the bone marrow. We have blood vessels flowing in the bone marrow. And then the osteocytes actually have tiny tunnels connecting to each other, forming a network. And then eventually everything gets nutrient from the blood vessel inside the bone marrow. And then what if your bone wants to grow? The surface, these are osteoblasts. And those are osteocytes. So an osteoblast will produce a matrix called osteoid, osteoid. This is a matrix containing like collagen and other stuff. And then when the calcium comes, it deposits into the real bone matrix. And then the bone matrix hardens to form another layer. And then these cells capture, maybe caught between the two layers, the osteoblast eventually become the osteocytes and stay here, and then produce more tiny tunnels to feed them. So, and then what if you really want to dissolve your bone for many reasons? One reason is because you need release more calcium from the bone. And people believe that the development or evolution of the bone at the very beginning is not really a supportive system, but rather the storage of the calcium. What if you want to release calcium from the bone? Then you have the osteoclast. Osteoclast is a big cells, and osteoclast is not not one of the bone cells, but rather it's a blood cells. It's type of a specialized. This is osteoclast, and this is a specialized macrophage. I mean, macrophage a lot. Macrophage is very important. So macrophages. So what is coming here is released. They release what's the colorful acid. The release acid, and the acid will dissolve the bones, release the calcium out. Yeah, and this is one major reason why the osteoclast coming here release the calcium. Another reason is that what if you have a pressure? You have a pressure from this side, and then the osteocytes will sense the pressure to send other signal to recruit the osteoclast to make this side of the bone a little bit thinner and thinner to adapt to the pressure. That's the other reason why osteoclast. I think that's all for this chapter 6. See you next time.